MTA workers will be getting free COVID testing under a new initiative aimed at frontline employees. This comes as the city braces for a second wave of COVID-19. Here to tell us more about it is MTA Chairman Pat Foye. Welcome back to the Pixel Morning News, sir. Thank you for joining us.
Dan, thanks for having me.
So, Governor Cuomo announced the initiative yesterday. When do you expect to begin these screenings for the 2,000 plus employees per week that will be able to get them?
Dan, it began yesterday. This is a first of the nation program. It's three prongs. We are taking testing to our employees at bus depots and subway yards. We're going to do that on a rotating basis, and it is going to be determined by data from the State Department of Health that our occupational health services folks will look at. Beyond that, employees who go to our medical assessment centers, there are 3 of those for New York City Transit and 2 each for both Metro North and Long Island Railroad. Employees who go to one of those facilities can take advantage of this testing, which is voluntary. And then thirdly, the free rapid diagnostic testing that we're doing with Northwell Urgent Care Centers will continue, and any of our employees who want a rapid test will be able to get it, and that's free. Our goal in this case, Dan, is to minimize public health risk to our employees and customers.
I'm having a little tough time hearing you because there's some kind of echo there. But did you say who gets priority here in deciding who gets tested first? It is a voluntary basis, but is there priority, say, if somebody older comes in?
That obviously would be a factor if there was a comorbidity. But we're going to go to the workers, Dan, and for instance, if there was a cluster in one of the 5 boroughs, we go to transit facilities, subway and bus facilities, and that borough. It's going to be data-driven by data that we get from the State Department of Health.
Oh, that's smart and excellent. All right, so an estimated 2,000 workers started yesterday. Any chance that number could actually go up since you have a heck of a lot more employees than that?
Well, it's 2,000 employees a week. We intend to make this service available to every one of our employees who wants it in the 5 boroughs, at the Long Island Railroad, and Metro North, bridges and tunnels as well.
You know, and obviously we've seen citywide with testing that the biggest complaint that people have when they go to get their test is it takes too long to get the results. So how long will it take to get those results back?
Well, the rapid testing at Northwell, for instance, is 15 to 30 minutes. The other testing, it's 24 to 48 hours. We're working with BioReference and Quest and Northwell Health on these issues, who have ramped up and provided tremendous public service to New Yorkers, but especially to transit workers.
Good information there. I want to switch over to ridership because this obviously impacts ridership, right? It's all an effort to keep the workers safe, but also keep the passengers safe as well. And the number of commuters using subways and buses is still way down. So do you project any changes in the near future? Because we're seeing coronavirus cases kind of tick up in our area, and that's alarming for some folks.
Well, look, there have been clusters. I think it's fair to say that Governor Cuomo has stamped out the embers, and New York continues to be the state with the lowest infection rate right now. Our goal in this program is to minimize public health risk to our employees and our customers.
Yeah, of course.
From a ridership point of view, on subways and buses together on an average weekday, we're now pretty close to carrying 3 million passengers. Obviously, that's still dramatically lower than a typical day pre-pandemic, but ridership on buses and subways has increased substantially from the depths of the pandemic, and we expect that it will continue to increase. I will note that the decline in ridership has obviously had dramatic impact on our revenues.
Of course,
we get about 50% of our revenues from our customers.
So that's my last question for you. How long can it take? How long can you go on like this, really, before you have to start raising fares? You know, I ask you that often.
You do, and you've been consistent, Dan. At our August board meeting, we said that if we don't get $12 billion in federal funding from the federal government, then obviously that has not happened. The Senate has adjourned for the election. But if we don't get that level of funding, we could face on subways and buses up to 40% service cuts, up to 50% service cuts on Long Island Railroad and Metro North, and having to lay off over 8,000 of our colleagues. No one at the MTA wants to do any of that. And the only thing that will not force our hand in taking and considering those actions is federal funding at the $12 billion level. it's also an equity issue because most of our customers right now are first responders and essential employees who don't have the option of driving to work. They don't have the option of working remotely. And there's a social equity a priority in terms of funding the MTA, especially at this point in time, given the ridership and who our riders are. Our transit workers are heroes, moving heroes. Our passengers are those heroes.
Absolutely. MTA Chairman Pat Foye. Consistency, that's something I always will. You know, I'm always going to ask you that question. But always thank you for coming on and making the time to explain these issues. By the way, last time you were here, you were wearing that bright shirt, said stop the spread, said you were going to get me one. I'm just checking my mailbox every day.
I owe you a shirt. I'll get you one.
I'm just kidding, sir. Thank you for making the time this morning.
I'm not.
All right. Appreciate it. Thank you very much.